Hey everybody, this is Dr. West from the Iowa Chiropractic Society. I'm the president. Awesome experience here to interview Dr. Jay Greenstein. Did I say that right, Greenstein?
Yes, you did. It's
All right,
Greenstein.
sweet.
Thank you.
I saw Dr. Jay this past November at the COXA event and just blew us away. And so we are very, very excited that Iowa is bringing Dr. Jay here for the first time to Iowa. So we're going to go through a little questions here. We'll go from there. So Dr. Jay, if you would, I want to hear more from you. So give me a little background about you. Why are you passionate about chiropractic and speaking? And, why are you doing this instead of, just sticking to your office and working?
I think there's a good word for that, and I would call it justice. Chiropractic is such an important part of helping people get well and stay well. And unfortunately, for a variety of political and economic reasons, chiropractic has not had its fair shake up to this point. And I feel like it's my responsibility and collectively our responsibility to ensure that the public understands the positive impact and the immense value that chiropractic brings to our nation and to the world at large. So speaking about a variety of topics, being involved at multiple levels as it relates to clinical guidelines. I'm currently chair of the Council on Chiropractic Guidelines and Practice Parameters, now known as the Clinical Compass, or chairing the Government Relations Committee so we can work on federal legislation to ensure things like Medicare equality. Those things I'm super passionate about because the population that we serve deserves to have chiropractic care, deserves to have access, deserves to have all that chiropractic brings, and the providers that are delivering that immense value also deserve to be rewarded for that value that they're delivering. So I'm just in it for the good of humankind, but also ensuring that we win the battle.
Awesome. Yeah, and that's I definitely gathered all that from when you came in. I remember you talking about justice at COXA, and that resonated with me. That was really cool. One of the things I want you, if you could add, is I know you do some lot, like you talked about Medicare, equality, and making sure we get our fair share. What would you say though is maybe to the docs that don't deal with insurance? We all need to work together as a team, right? So what can you bring to some of those docs that maybe aren't, say, 100% insurance, or I don't know, maybe they don't care? What can you offer some of those other guys and gals?
Yeah, that's a great question. I've got some great friends that have no insurance practices and their cash practices, and they're very happy and very, very successful. And I have great admiration for them. When I talk about today's chiropractor and I talk about how we use the evidence to change the way the world is working, I think it really is not just about insurance or reimbursement.
Right.
Guidelines drive the way patients make decisions. And when we can arm our doctors with the evidence and they can use that as ammunition to ensure that patients are informed and make really good decisions about their healthcare, that's a win. Policy issues, fairness for chiropractic and doctors of chiropractic, and access for patients who want chiropractic care, that doesn't necessarily have to do with reimbursement. I'll give you an example. We just worked on a travel to treat legislative language for travel to treat, so that sports teams who have doctors of chiropractic, on their healthcare team could actually travel with their doctor across state lines and not violate any licensure issues. Myself, John Filardo, who's the ACA VP on Government Relations, my good friend, Dr. Alan Sokoloff, who's the chiropractor for the Ravens, we literally lobbied on Capitol Hill, which is 6 blocks from my house. I live in DC.
Nice.
And we met with the chief legislative folks and said, look, these athletes, they deserve to have chiropractic care. If the medical doctors can travel across state lines, then any licensed healthcare provider should have those same rights. And so utilizing the clinical guidelines that demonstrate the value of chiropractic, the value of the chiropractic adjustment to change policymakers' minds actually can impact any doctor of chiropractic. It has nothing to do with reimbursement. And by the way, that did pass in the House, and we are expecting that legislative language that that we influence will pass in the Senate early this year, and doctors of chiropractic will be able to travel with their sports teams across any state in the nation. So we use clinical evidence to help improve the profession. It has somewhat to do with reimbursement, but it has a lot to do with a whole lot more.
Exactly. I mean, it's about the profession as a whole and not the specific exact way that we want to practice, right?
Absolutely, Wes. Absolutely.
Awesome. Very cool. Give us a little tease here, because people are like, well, why do I want to come see this guy? There's going to be a couple other speakers there. So if you can give us a little tease of maybe some talking points of your talk, and then maybe there's something that even they could take home just from this short conversation today that could fire them up for the next day, or that they can implement to help them out on Monday or whenever they listen to this.
Yeah, absolutely. So we live in a new world of healthcare, and the new world of healthcare is all about creating value. And my goal when I come and speak in Iowa, which I'm super excited about and actually humbled to be even asked, but my goal is to create as much value as possible. And in doing that, it's about understanding how to leverage the literature for 4 key elements, and I call them the 4 Ps. First and foremost, it's about educating patients. How do we use the evidence to educate patients about the care plans that we're recommending? So I'll give you a little tidbit right now. There was a couple of different papers that were published by a well-known chiropractic researcher by the name of Mitch Haas. Mitch Haas, he looked at dosing recommendations. So he randomized a group of patients. One group of patients got treated 1 time a week. Another group of patients got treated twice a week. A third group of patients got treated 3 times a week. And a fourth group of patients got treated 4 times a week. And he looked at each group and how they progressed and improved in both pain and disability. And what did he find? He found the patients that got treated the most frequently actually got the most improvement in both pain and disability. I use that in my report of findings. When I'm explaining to a patient why I'm making clinical recommendations for them, I'm using the evidence. It's not because I want to improve the cash flow of my practice. It's because I want to create the most value. I want to get the patients better as fast as humanly possible. And when they understand that I'm giving them evidence that supports my recommendations, it creates trust. And when you have trust with the patient, they'll listen to your recommendations, follow your care plans, and get better, and then turn into raving fans. And then, of course, refer a lot more folks into your practice, which is one of the ways that we've grown to a multi-million-dollar, multi-location practice. So that's the first P. The second P is about payers. How do we use the guidelines to ensure that payers pay for the care and value that we're delivering? And I will walk through the clinical algorithms that demonstrate the treatment frequency and durations that need to occur and that should occur in order to ensure that patients get the care they need. And we have fought many battles at the local level and at the national level using these guidelines to ensure that payers pay for the care that our patients deserve. So that's the second P. The third P is really all about other healthcare providers. How many times have we heard a medical doctor say, I don't believe in chiropractic?
Right.
And those days, my friend, are over. And it is one of my missions to make sure that medical doctors don't have that false belief. Chiropractic is not a belief system. It's not a religion. It's what it is. It's an evidence-based profession. And so when doctors of chiropractic understand all the evidence that's out there that supports what we do, not just in the chiropractic literature, but in the healthcare literature at large. And I'm going to show the attendees at the conference all the different areas where our literature is used to demonstrate that what we do is super effective and that there's high levels of evidence that support what we do. We can influence other healthcare providers to ensure they're making the right care recommendations to their patients and referring to us for the appropriate healthcare needs of their patients. And then the last P that I love talking about, and we've touched on this briefly, is policy. How we use the clinical evidence to influence policy. And policy could be at your local Rotary Club. It could be at the local employer group that's self-insured that doesn't have a great chiropractic benefit, or it could be at the national level changing federal legislation. And so we're going to talk about those 4 Ps to help doctors really understand how to leverage the evidence in order to grow their practices and have a greater positive impact. So that's a little tidbit. And then there's a little special bonus section at the end, which I really enjoyed talking about, which is, I'll just say it's a special bonus section, which I know just from feedback that I've gotten from other attendees at other conferences at state associations, really drives home the importance of leadership. And we'll touch on that at the end, which I think folks will really enjoy.
That's awesome. Yeah, we got to be the leaders in the health profession, I feel. But it
Absolutely.
sounds like you're going to be bringing the, not just, I mean, you got the science heavily, which is awesome because remember, chiropractic's the pillar, right? We got 3 pillars: science, philosophy, and art. And we got to have that equal balance of all 3. So it's really cool to see some of the science catching up with our strong philosophy and in the art of the adjustment. So,
amen. And what's really cool, Wes, is that I've been exposed in the research side of my world to some amazing folks, and I'm going to introduce some literature from a researcher, Heidi Havik, who's out of New Zealand.
Oh yeah, she was awesome.
And you saw her at Coxa, right?
I got my picture in the book. She's fantastic.
She's amazing. I made sure I got a picture with her too. I'm not really like one of those people that's awed by like celebrities or sports stars. But man, when I first met Heidi, I was like an Uber fan right away. I had love in my eyes. But what's so interesting, and it's so great that you mentioned science, art, and philosophy. What Heidi is doing, and what we'll talk about in Iowa, is how the philosophy of chiropractic is now being proven by the science, which is just incredibly cool. It's coming full circle. And so we'll talk about that as well.
Awesome. I'm getting a kick out of your dog in the background. You keep coming up and down.
Hey, this is real life, Wes. We all have them. We all have real lives. And so it's just, this is what it's like. And I love my puppy. And there he is, just
absolutely. I'm a dog guy too. But I think that's fantastic, man. I don't have, if you have anything else to share, that's great. But I'm excited. A conference is, you're going to be speaking on Saturday, April 22 of this year. And I'm stoked, man. So I'm happy to host you here in Iowa, and hopefully we can hang out a little bit and catch up.
Well, you and I will definitely hang out like we did at Coxa, and I'm just grateful for the opportunity to be present at your convention.
Awesome. Cool. Thanks, Dr. J.
Thank you, brother. Good talking to you.
You bet.
Bye.